When I was 7, my mother, a white working class nonprofit director, unwilling to relive the trauma of my hospital birth, gave birth to my sister in our home. It was a windy April morning. She labored between the bedroom and the bathtub, surrounded by midwives, while my aunt, who lived on the second floor, anxiously made everyone nachos in her new microwave. Fast forward 2 years, and she's at it again. Same bedroom, same time of year. But this time, I was busy reading Nancy Drew mysteries in my bedroom and told the midwives to let me know when she was crowning. It was 1989. In the years that followed, I never fully understood the shock and awe from adults who learned about her home births and marveled at the fact that I was there. These experiences were out of the norm for many, but they were the only birth stories that I knew, and they shaped my worldview. At a young age, I knew that people in labor are ridiculously powerful, that they need to move around and they make loud noises, and that midwives are exquisite care providers. After college, I moved to Boston and began working in public health. I dove headfirst into understanding the impact of racism on health, and in particular on birth outcomes. I was in my reproductive age, and I could not escape the truth of the data that my degrees, my income, my straightness, nor my cisness, nor my access to insurance or prenatal care could protect me from a bad outcome as a Black woman. I felt dissonance. Dissonance is defined as the tension between disharmonious events. And I would feel that dissonance for the next decade as I traversed the city, sharing data about how much worse birth outcomes were in the Black community, while I opted out of hospital care and had my own 2 candlelit water births, tended to by magical midwives in my home. I felt like I had a foot in each reality. Then one day I learned that Boston midwives had long been dreaming of a birth center, a third option, out of hospital midwifery in a home-like setting, covered by insurance, and nestled in the Black community. The record of the soundtrack of my life scratched. The idea of birth center care, offering professionalized midwifery care in our neighborhood without the out-of-pocket costs that I incurred, I was hooked. I'd spend the next several years testing this idea, gathering folks in the park under a tent, providing bagels and snacks, and asking, if we build it, will you come? In this time, I also began to learn about how birth centers operate. And I learned that most rely on the savings or personal credit of a midwife. They receive low insurance reimbursements that doesn't cover their costs, or they choose to serve only those who can afford to pay cash. I learned also that midwives who open birth centers often go without taking a salary, or they earn 50% of their hospital counterparts. With every conversation, I felt dissonance again. The tension between this burning in me to bring the model of birth center care to Boston and a fear of how to pull it off, because every birth center leader I spoke to was yelling, "Fire, run!" And here I was lacing up my sneakers and running into the blaze. Reintegrating community midwifery isn't easy in a country that has actively divested from the practice. There was a time in this country when midwives provided care to the community and caught all the babies. But in the early 1900s, a physician-led, government-backed campaign sought to delegitimize traditional midwifery and systemically advantage hospital-based obstetrics. Steeped in racism, classism, and sexism, this move has had a lasting implication on our healthcare system and specifically on maternal health outcomes for Black, Indigenous, and immigrant communities. And I'm not stretching when I say this divestment in midwifery is inextricably tied to the fact that the US has the highest rate of maternal deaths of any economically advantaged country. Let's pause and let that sink in. We divested from midwifery, and now we have the worst maternal health outcomes of any advantaged nation. And within the US, the outcomes are by far worse for Black women. But here's what we also know. Midwives save lives. And for the last decade, I've been working with policy wonks, finance nerds, midwives, and architects to crack the code to a sustainable birth center. And because I'm a public health girly, I was trained to think at the level of population health. So we're thinking about how the model can be replicated in other communities. And because we know that birth center care boasts better outcomes, meaning fewer C-sections, lower rates of preterm birth, and better experiences, Birth centers also return significant savings to the healthcare system. Get this. If we shifted just 10% of births from the hospital to community birth centers, the US would save $1.9 billion annually. I believe every community needs a birth center, a home-like facility, freestanding from a hospital, providing full-spectrum midwifery care, care that can be covered by insurance, commercial and public. It's a healthcare space where our full selves, our bodies, our traumas, our identities, and our relationships are honored and belong, where equity is operationalized in everything from centering mass health to who holds the contracts to how the organization is governed. And we're building it from the ground up, and that means building deep strategy and partnership with community organizers, hospital leaders, zoning experts, philanthropists, local artists, and you. For the last few years, I've been deeply moved by the writing of Arundhati Roy, Indian author and political activist who wrote about the COVID pandemic as a portal, a gateway between one world and the next. She wrote, "We can choose to walk through it, dragging the carcasses of our prejudice and hatred, our avarice, our databanks and dead ideas, our dead rivers and smoky skies behind us. Or we can walk through lightly, with little luggage, ready to imagine another world and ready to fight for it." We are living in a dystopian time of trauma, fascism, and the dominant mindset is scarcity. But I think the portal is still open. Like many in this country right now, I swing on a heavy pendulum between packing my bags or encircling myself in community and drilling down deeper into the fight for justice. When the Boston Zoning Board dismissed us last February, I had a fleeting moment of throwing in the towel, feeling like maybe after all, Boston doesn't want a birth center. But I quickly swung or was slapped back to a place of optimism. There was that dissonance again. And when I feel dissonance, I try to drop into my body, to feel what the future I believe in actually feels like, to imagine walking through that portal. So I want to invite you to what I see when I look through the portal. Join me. Close your eyes if you want. Put a hand on your heart or your womb if you want. Feel the support of Mother Earth under your feet. Feel yourself surrounded in beloved community. Take a deep breath. And imagine with me your community birth center. Imagine a beautiful spa-like place with fine linens, plush robes, and fruit-infused water. There's a kitchen for families to heat up soup and lasagna for that first postpartum meal. The space is lovingly staffed by midwives, providing full spectrum care, family planning, medical abortion, gender-affirming care, labor, delivery, postpartum, and menopausal care. There's wraparound care from mental health providers and body practitioners, providing Reiki, yoga, and massage. There's a sound of expectant fathers chatting excitedly in Spanish before their childbirth ed group. There are people in labor, free to move in whatever way is most supportive to them. I can see them crouched in a labor garden, leaning on a bench, or suspended by a rebozo. There are children asking questions about bellies and boobies, answered lovingly by adults, aware of their simultaneous transformation to big sibling and their expanded worldview. Your queer immigrant neighbor is skin to skin with their new baby and encircled by chosen family. There's a birth lantern, lit in ritual, a glowing signal flickering so the whole community knows that a baby has arrived. If your eyes are still closed, I welcome you to open them. Take a deep breath. I imagine that lantern to be a signal for all of us that change is afoot. It's lit by our collective fire. It lights our way through the portal, calling us into a future that is healed and whole. This doesn't have to be some distant vision. This birth center will open. It will open in Roxbury, and in Lynn, and in Worcester, and in your community. Thank you. Thank you.